Hello, my name is Dr. Epps, and I am a pediatric radiologist at Wake Radiology. I'm from Wake Forest, North Carolina, which is just north of Raleigh, and it was a wonderful experience, wonderful place to grow up. Small town at the time, but has grown exponentially since I've been there, and I'm excited to be back and serve the people of my community. I realized I wanted to be a doctor when I was around 16 years old, and I had to be hospitalized after a car accident. And the interaction I had with the doctors and the nurses were positive and encouraging, and I realized that's what I wanted to do with my life. I completed medical school at the University of North Carolina in Chapel Hill, where I also completed residency in radiology. I then went to Houston, Texas, where I did a fellowship in pediatric radiology at Texas Children's Hospital. During the course of my training, my wife and I were able to have our 3 boys, and it's really my 3 sons and my wife that have given me that balanced life that I need to be the best physician possible for my patients. What drew me to the field of radiology was the breadth of pathology and the variety of cases that I was able to see. As a medical student, I was fascinated by everything. I enjoyed everything, and that was a little bit of a problem when it came time to choose a subspecialty. But then I found radiology, which included all of those specialties, and I had to be able to talk to a family medicine physician, as well as a neurosurgeon and even orthopedic surgeon, and that was exciting to me. What I loved most about my training to this point was the people that I had the chance to meet and interact with. As a medical student, as an intern and a resident, you don't know a whole lot, but there are so many people around you that give you that support and help you become the doctor that you want to become. And it's those relationships that I treasure to this day. What makes pediatric radiology special is the patients. These kids are excited and loving, but they also wear their emotions on their sleeves. So they'll tell you when they're upset, they'll tell you when they don't like something. And it's very gratifying when you could be the one to figure out what the problem is. You not only help the patient themselves, but you help their families. And sometimes it's the parents who are even more anxious or worried than the child themselves. And being able to provide answers and help the whole family is what really makes pediatric radiology special. What I want for my patients and my patients' families is to have confidence that we can solve the problems, that we can help figure out what's going on with their child and get them on the path to recovery. My patients would be surprised to know that I enjoy genealogy. I enjoy learning about my ancestors, and in particular, I have a lot of ancestors that were right here in North Carolina, and my own paternal grandmother served as a nurse here in Wake County in the 50s and 60s, and her husband, my paternal grandfather, worked as an SBI agent for the State Bureau of Investigation, and so I have strong roots and ties to the area, and I look forward to serving this community. What I'm most excited about joining the Wake Radiology team is the seasoned and experienced physicians that are already here that can provide me support at the beginning of my career. I'm also excited to work with the local pediatricians and pediatric subspecialists that I've come to know in my course of training at UNC.